Welcome everybody. I'm Peter Bradley, Director of Public Health Development at Public Health Wales. I'd like to welcome you to this online seminar called Empowering Communities to Better Health, which has been arranged by 1,000 Lives Improvement Service in Public Health Wales and Caerwyn, the Centre for Health System Innovation and Improvement for Counties Manukau District Health Board in New Zealand. This is a really exciting opportunity for professionals to connect across 3 time zones, so good morning, good afternoon and good evening, and share their knowledge with over 80 international participants. So we will be hearing from experts from Caerwyn, Jonathan Gray, the Director of Caerwyn, Alexandra Nicholas, leader of the Handle the Jandal campaign, Margaret Aimer, Development and Delivery Lead, Alex Twigg, Campaign Manager. As well as this, we will hear from Hahrie Han, Associate Professor at Wellesley College, Boston, USA. Each of our experts today will introduce themselves throughout the seminar with a story of themselves, a tradition within the community organizing space.
I'm really excited to talk to you today. As Peter said, usually in organizing, a tradition that we have is we start by talking about our own stories about how we got to this work. And I'll just sort of say briefly that, I grew up as the daughter of Korean immigrants in Texas, which is in the southern part of the United States, and I grew up in a primarily white community. And my family was very apolitical growing up. Like, I had no concept of what organizing was. But it wasn't until I went to college and I happened to take a class on community organizing that my eyes really became opened to it in a new way, because what organizing did was it gave me the opportunity to take the anger that I had at experiences that I had growing up and turn it into something productive. So I'm thinking about times when I saw store clerks refuse my parents' money because they had a funny accent, or when our next door neighbors robbed us, and sort of things like that, where I never really quite knew how to react when I was a kid. But organizing is a mechanism that allows you to, that allowed me to take the disjunct that I saw between the world as it is and the world as it should be, and take that anger that I felt because of that disjunct and turn it into something productive. So organizing, I'm just going to move through my slides here. So organizing then, what it really is it's an approach to social change that allows us to sort of solve a range of the different kind of social problems that we might see in our lives. And the way that I define organizing is that it's a form of leadership that enables a constituency to turn its resources into the power to make change. So there's a lot to unpack about that definition. But basically, the idea is that there's a group of people that wants to make some kind of change, but right now it doesn't know how to take the resources that it has and turn it into what it wants. So organizing is a tool that allows you to link what you have and turn what you have into what you want, which are your goals. And you do that by building the power that you need. So the way we think about organizing really is that the way that you build power is through a process of leadership development. So what happens is that you begin by developing leaders, and once you build those leaders, then you develop community around those leaders, and then you draw power from that community, and that's how organizing works. So again, just to sort of reiterate, the idea is that you start by building leaders, and then you build community around those leaders, and then draw power from that community to achieve the change that you want. And so leadership in this context is very different from the way that we might think about leadership in other instances. It's not about having a certain position or a title, but instead it's about taking responsibility for enabling others to achieve purpose in the face of uncertainty. So that's a definition that Marshall Gans, who's an organizing guru, taught me many years ago. And there's a couple things to unpack about that definition. First is just the idea that you don't need a leader if you don't have uncertainty. So if we're doing things like the annual budget or annual performance reviews or things like that, then you don't really have any uncertainty. And so what you need is you just need a manager, someone who's going to manage the entire process. But it's when you have uncertainty, such as in moments when we're trying to make some kind of social change, that you need someone to be a leader to help you navigate that uncertainty, and that's what leadership is. But the way that we think about leadership and organizing is that it's not about the leader doing all the work, him or herself, but instead it's about the leader enabling others to do that work. So the idea, again, sort of going back to this idea of building power, is that it's not that I'm going to do the work to solve the problem for other people, but I'm going to help other people build the power that they need so that they can solve the problems that they want to solve. And so organizing in that context is really different from other approaches to social change. And so we can imagine that there are all sorts of different kind of challenges that we face. Everything from poverty to obesity to chronic disease to mental health problems, all sorts of problems that we might face, and different problems are going to require different kinds of solutions. And so I don't want to say today that organizing is a panacea for every kind of problem out there, but in fact, there are certain kinds of problems for which it might be the right way to go. And so let's think about what those problems are. So to start, there are some problems where all you need to do is raise awareness, right? Oh, and sorry, I should step back and say that when we think about sort of how do we know what kind of problems we have, then we start by developing sort of a theory of change. And what a theory of change is an idea that if I do something, then I will get the result that I want, right? So a lot of times I've been in rooms where people will sort of say, obesity is such a big problem. It's obviously a growing problem in the United States. And so what we need to do is we need to raise awareness about the health impacts of different kinds of food, right? And then the theory of change behind that is if we give people the information that they need, then they will make the changes that we want in their behavior, right? And so the theory of change behind a raising awareness campaign is that the problem to be solved is one of information. And there are certain problems that are like that, right? When we used to put babies to sleep on their stomachs, all we needed to do was raise awareness about the idea that it was safer for babies to sleep on their backs. And then all the parents who are very and deeply invested in the health of their children made the changes that they need, and so rates of infant death went way down. And so there are certain situations where information is a problem. There are other situations where what you need is technological innovation, right? When someone gets sick or when polio was a problem, what we needed to do was create a polio vaccine, right? And so that was a situation where the problem that we had to solve was one of technology. And once we developed the technology, then we're able to eradicate the problem that we needed. There are other problems, for example, where what you need to do is change the incentives that people have. So, for example, if we want people to exercise more, then you see lots of companies, for example, and health systems that will give people a free gym membership. And the theory of change behind there is that right now people aren't really making the choices that we want, but the people who have the power can change the incentives so that people make the choices that are more consistently aligned with the goals of the people that have the power. Now, the last two categories, the idea of services and organizing, those apply to situations where the people who want the change aren't the people who have the power, right? In the case of institutional incentives, the people who want the change are the people who have the power, right? The people who, it might be the government, for example, that wants to lower health costs and therefore wants people to engage in healthier behaviors. But in other situations, for example, when we have a lot of natural disasters, we end up in, I'm just going to move through the slides here, we end up in situations where the people who want the change the most don't have the power to work on it. So the picture on the slide is an example of the typhoon in the Philippines a few years ago where disaster was wreaked on entire communities, and those communities didn't have the power to make the changes they needed, namely to rebuild their communities. And so international aid organizations poured in from all over the world to help the Philippines rebuild their community. And so the theory of change there is one in which those who have the power to make the change make it for others. Now, organizing is different from all of these approaches to change in the sense that it's an approach to change in which the people who want the change the most don't have the power to make it. And the way that you make the change is not by doing it for them, as in a service-driven approach, but instead by helping them, the people who want the change, develop the resources they need to make the change that they want. And so the picture that I have on the slide there is an example of the Montgomery bus boycott in the United States, where the people who wanted to change was the African American people in the South that wanted to integrate the buses, but they didn't have the power to make the change that they wanted. So what did they have to do? Well, they had to organize, and what they did through organizing is they built the resources within their own community to make the change that they want. And the resource that they were able to leverage was their bus token, right? And they turned that bus token into power by using that bus token collectively, right? By everyone coming together and withholding their bus token, it became a source of power that allowed them to make the change that they wanted. And that's basically what organizing is. Organizing is a series of leadership practices that is designed to help people who want the change work with others to turn the resources that they have into the power to make the change that they want, right? So it was a process that the African American people in the South went through to work together to turn their bus tokens into a source of power so that they could integrate the buses. And so really, when we think about when we organize, it's really sort of dependent on what the problems are that we're trying to solve. And so generally, the way that I like to think about it is that the first question to ask is, what is your purpose, right? And I think organizing is good when the purpose, when your goal is not only to solve problems, but also to solve problems in a way that creates a new source of power or builds new capacities among the communities or constituencies in which you're working. Second, there's this question of who are your people, right? Are you working with people, do the people that are most motivated to make the change have to collaborate with others or compete with others to get the resources they need, right? If I am, if I'm President Obama, then I don't necessarily need to organize because I have the power in some instances to make the changes that I want. But if I am a black person in the South in 1950s Alabama, then I don't have the power that I need to make the changes that I want, so I have to work with others to turn my resources into the power that I want. So you have to think about who your people are. And then finally the question is, how do you build that power? Well, usually you organize when change requires using resources in new ways, right? So if I already have the resources I need to make the change that I want, if I'm already the boss, and I can just give free gym memberships out to my employees, then I don't need to organize. I can just make that decision. But in situations where the people who want the change don't have the power to make it, that's when you might begin to organize. So I think I'll stop there for now, and I think we're going to go back to Jonathan now to let Jonathan talk about some of the work that we've done in New Zealand.
Good morning. It's Jonathan Gray in New Zealand. I'm the director of Koawatea, which is our Centre for Education, Improvement and Innovation embedded deep in the front line of Counties Manukau District Health Board. Counties Manukau District Health Board have a remit legally to deliver health and well-being for an entire community of 500,000 people. But I wanted to start and thank all of you for joining us, and thank Hahrie for that brilliant introduction. About me, I grew up in a single-parent family, and this picture, believe it or not, that's one of the streets I grew up in. The cars were slightly newer when I was there, but actually the houses and the industrial environment were exactly the same. As I said, I grew up in a single-parent family, and I never forget that I owe my house, my education, and often the clothes that I was wearing to school to the support of the state, but most importantly to my community. I repeatedly as a child experienced examples of my community bringing hope to a struggling family. There was a turkey dropped off at Christmas by the local territorial army, the Salvation Army calling at our home every Christmas to play carols, the fire brigade driving by to check my mum when she was ill and poorly mobile. So growing up in a money-poor but a caring, rich community, I learned the value of community support to achieve outcomes that could not have been achieved simply by me as an individual or directly by just state support. I've never forgotten those lessons, and they've made me think about the application of those principles using my and our community for health, as I've worked as a doctor, both as a clinical geneticist and later as a public health doctor, in trying to improve the system that I was part of. So back to the current day for me. As the second largest district health board in New Zealand, Counties is responsible for providing health services to over 500,000 people. It's also one of the most diverse environments, with 22% of our residents are Pacific. We operate mainly geographically in South Auckland, and Counties works with a population that faces higher rates of social deprivation than other parts of the country. 34% of our citizens in Manukau, 43% of its children, and 74% of its Pacific population have incomes in the lowest 2 deciles of New Zealand. Despite decades of effort attempting to elevate their health status, the Pacific population still faces comparatively worse health outcomes. Our Pacific and Maori populations have a life expectancy of 77 years as compared to 83 years for non-Maori and non-Pacific. The population, as you would guess from this description, has disproportionately high rates of chronic disease, diabetes, heart disease, and other health conditions. Critically for this conversation today, in recent years, a rash of suicides has brought attention to the growing problem of poor mental health among our Pacific youth. Meeting the health needs of our Pacific population has placed a moral and financial stress on Counties Manukau Health. And as an executive member of that team, this is at the front of our mind as we look forward. Poor health, as you all know, leads to a high demand for expensive hospital services and hinders Counties' ability to fulfill its mission of working in partnership with its community to improve the health status for all, with particular emphasis on Maori and Pacific peoples and communities. This challenge is heightened as our population is growing rapidly. 60% of our Pacific population is under 30, and it will grow to 81% by 2026. As a previous chair of our board said, a very fast train is coming down the track, and we don't know how to stop it. So for Counties Manukau Health, like many of you, meeting those health demands will depend on meeting what our friends at the Institute for Healthcare Improvement call the triple aim: better health, better quality, all delivered at lower costs. But Counties, like many of its counterparts and many of you that I see on the line around the world, have struggled to achieve this goal. One approach to addressing that growing health crisis in South Auckland and achieving the triple aim was to focus on preventative care. And historically, much of Counties' relationships to its residents, though, has been reactive. Our services kick in when a person comes to Counties for a service. Often, as you know, that is too late. Meeting this expanding demands on the health system requires us to shift from intervention to prevention, from reactive care to proactive health promotion. Physical and mental well-being starts at home, not in the hospital. So, like many of you around the world, we've been slow in absorbing this lesson, but in the past, health systems have made many changes that haven't led to the improvements we desired. Within the context of secondary care, though, I and perhaps you have felt more confident, and we've moved to a patient-centered care and patient-based experience co-design, and I think we're making significant headway. But what of health and healthcare settings beyond the hospital's four walls? How can health systems like Counties support residents in creating shared responsibility for health to take measures to prevent illness, stay healthy, and seek help early? We've heard already from Hahrie and that wonderful introduction, but I was lucky enough to meet Hahrie and Marshall Gans back in 2004 when I was privileged to be a fellow at the Institute for Healthcare Improvement in Boston. I learned, like we've heard today, about social movements that resolved seemingly intractable social and political problems. And I also got that glimpse that they could be used to resolve some of the wicked problems that confront us in healthcare. Poor Hahrie. I often think about this. After my IHI fellowship, I persuaded Hahrie Han to travel all the way to Wales to help and teach us as part of our learning around the 1,000 Lives campaign. And I know the impact that Hahrie made in Cardiff and across Wales with those first meetings. But then I moved to New Zealand, and I immediately called up Hahrie and brought Hahrie over to work at Koawatea, our Centre for Improvement and Innovation. And Hahrie started by training 9 of our staff in a 14-week online community organising course that gave birth to our first community organising campaign that Alex is going to talk about in a moment. So I'm going to stop now, but I hope you can see the journey actually began for me in Boston. We moved it to Cardiff, and now we've been lucky enough to keep that link between Cardiff and all the way over here at Coahuatea, and Hahrie has been an intrinsic and important link in that. And to hear a little bit more now about what we've been doing here in counties, I think we're handing over to Alex.
Kia ora koutou, kia orana, and hello all. My name's Alexandra Nicholas, and I'm joining you from the beautiful Honolulu in Hawaii, aloha, where I'm helping to run a community organising training. But I'm very excited to have this opportunity to connect in all with you at this moment and to share a bit about Handle the Jandle. And part of the story that I'm going to tell is my own story, and I'm going to do it in the style of Pecha Kucha format, which is basically 20 slides on an automatic rotation of 20 seconds per slide. I was born and raised in South Auckland, New Zealand. I'm both Cook Island from Rarotonga and Indigenous New Zealand Māori, and I'm the second eldest of 4 siblings. And I was born into a strong Christian home to parents who absolutely loved me and my siblings, loved the Lord and loved people. And I remember seeing so many examples of this growing up in my life. But at the age of 18, my family moved to Australia, and I made the individual decision to stay behind to complete my university studies because I was on scholarship and also because I thought I was in love. But by the end of those 4 years, I was much heavier and I decided that I needed to do something for my health. So I did a detox. Fast forward 18 months, I'd lost 30 kgs, I was excessively exercising, I was starving myself, and I was absolutely terrified of getting fat. I was in fact diagnosed anorexic, which became a huge shock to me and my family, and I was referred to a mental health service in Counties Manukau Health. The first day I arrived at that service, I remember my lovely European eating disorders nurse saying to me, it's rare for Māori Pacific girls to come through our service. And I remember interpreting that in my mind to mean, we don't know what to do for you. And I felt 2 things in that moment. 1, complete powerlessness, and 2, outrage. At the same time, I was working at Counties Manukau Health, and I was one of 9 staff who was selected to do a 14-week online course on community organising. And so much of what I learnt in those 14 weeks, the values-based approach, the grassroots methodology, building leadership and power, resonated with me and what I believed. And the first thing I had to do, I was given this opportunity to launch a campaign around Pacific youth mental health. So I recruited myself a team, sharing a longer version of my story with them and listening to theirs. And we all came from a range of Pacific cultures and even educational levels, but we had one thing in common, and that was to see improved health outcomes for Pacific youth. Now that we had a team, we had to define our problem and our issue around mental health. See, we knew all too well what the statistics said about us. We were the ones that were drinking and driving, we were the ones committing crime, we were the ones unemployed, depressed, having babies young, and more recently, we were the ones that were taking our own lives. But when we spoke to 112 other Pacific youth, they experienced the issue in a different way, and they described it as living in 2 worlds. One world was steeped in faith, family, and culture, and the other world was about individual success at university, at high school, or at work. And actually, we just didn't know how to deal with our dual identity as New Zealand Pacific youth. And what we found was that actually we just didn't know how to deal with the pressure, and we just didn't know how to handle the jandle. And jandles in Pacific culture are often used as disciplinary tools applied with a bit of pressure to the hand or wherever mum could get it. And so we took this negative connotation and flipped it around and thought of it as youth handling the different pressures they experienced in their lives. So in April 2013, we recruited 25 youth to a 2-day intensive training. It was led by American-based expert organisers, and we heard stories over those 2 days from other youth about the pressures they experienced as New Zealand Pacific, and we were affirmed that this issue of pressure was one that was broadly felt, enough for the constituency, Pacific youth, to make a change. So over the 2 days, we were introduced to the 5 key practices of community organising: how to tell a compelling story that calls people to act with you, how to build relationships based on solid commitments, how to build strong team structures that are able to apply strategy and take shared measurable action together. So on the second day of the training, we were on the phones calling every single young Pacific person we could think of. We contacted 96 youth and confirmed 74 of those to come to our first tactics, which were going to be house meetings. Now, in order for us to really launch this campaign, we had to structure ourselves. So we put ourselves into the Snowflake campaign team structure, which meant that I was coaching each of my 5 leaders, and they were now coaching and leading their own team of 5. They all made up their own names for their teams, like Rise Above, Painkillers, Team Awkward, and each of those teams went out into the community. The first thing we did in the month of May was do house meetings. So instead of finding these youth at the movies or shopping, you would find us meeting in houses and church halls and library halls, getting more youth on board and a part of this campaign. And even parents started to get curious about why all these youth were suddenly meeting around this campaign called Handle the Jandal. One of the first goals we had as a campaign team was to launch the biggest Pacific Youth Workshop event, which we achieved in October 2013, 6 months after we launched out from the training. There were 150 youth, parents, community members, even ministers that were there that day attending this training, and it was awesome. In 2014, we had dreams and goals to really scale up the campaign, and we knew in order to do that we needed to build our team. So we went from a team of 5 to a team of 10. We also launched our Handle the Jandal brand, which was created and designed by Harrison, who's one of our members in the team. And one of the first things we did in 2014 with this new team was to partner with another group called Lotumo'oi and their youth team, and together we launched Rise to Conquer, which was a bigger version of Connect to Download, our initial workshop event, where we had nearly 500 youth, 100 community members, 10 workshops and more. One of our specific goals at Rise to Conquer was to understand what really mattered to Pacific youth underneath this huge issue of pressure. And what we found in those conversations we held that day in our workshop was that youth really cared about education, they really cared about passing at university, they really cared about depression, and they also cared about their relationship with mum and dad. So in July 2014, we were really excited to launch our next layer of trained leaders. We ran a 2-day training with 14 different Pacific youth who we recruited to help us really address these specific issues they had highlighted. And we had the support from our US expert coaches and organizers, but this time I led the training and my youth team facilitated. Handle the Jandal in only our first 18 months has been one of the most challenging but also rewarding pieces of work that I've ever been involved with. I have seen these youth go from strength to strength, and one of the things that's consistently supported us is our faith. This verse, where there is no vision, the people perish, is the one thing that I think Handle the Jandal is doing for youth in South Auckland, and that's giving them a vision and a hope.
Good morning, and good evening, and good afternoon. It's Margaret Aimer. I'm the Development and Delivery Lead here at Kawawatia. So you've heard from Jonathan and Alex a little bit about the South Auckland community where we work. But unlike both of those, I've lived most of my life in a neighbouring district of Auckland City, which has a very different demographic, predominantly white, European, wealthy, middle class. And I had little contact with communities like South Auckland until I came to work here as a medical student. What I experienced then was a hospital that mirrored its community. On the one hand, there was less money, greater levels of stress and disability. The buildings were really tired. In fact, a number of the hospital buildings were old army prefabs temporarily put up many, many years ago. The emergency room was really crowded, the staff were busy. But against that, I saw people working here who were passionate, who were smiling and positive, and who were just getting on with what was needed, even with few resources, and were visibly connected to each other. The hospital at that time was only 1 or 2 stories high, and it was linked with a long corridor that everyone walked along, staff, patients and families. It was called the Rainbow Corridor, and that's where the conversations happened, which meant that traditional boundaries and hierarchies that often exist in our organisations were ignored. And even at that time, our hospital here had a reputation for innovating and for learning from everyone. So when I finished my training as a doctor and then as a psychiatrist, I made the choice of a job here because I loved that sense of community. And 20 years later, I'm still here, now working with Jonathan and Alex in Kawawatia, designing and delivering our improvement work. Jonathan and Alex have talked to you a little bit about our community organising journey so far with the Handle the Jandal campaign, and I want to just share with you briefly some of our thinking about what next. Particularly 3 challenges or really questions which are shaping our efforts rather than things we have definite answers for at present. The first is around what we're calling our hub. How do we build the capacity among a group of people to teach community organising and to lead campaigns in an environment of capped resource when the methodology takes time to realise benefits and health outcomes? And we are having to think beyond a hub of staff, which is our usual way of operating, to a hub of people we've built relationships with. So Alex's leadership team that you just heard about and others in the Handle the Jandal campaign are key to establishing this hub. But we're still working out how to work with this group of volunteers rather than just paid staff to deliver our services. Secondly, we use a number of different approaches here to make change and improvements across our health district, and we want to better understand the alignment of community organising with our other improvement methodologies. So can we incorporate aspects of community organising, such as public narrative or the disciplined approach around coaching, into our standard approach to improvement projects? And from the other perspective, can community organising benefit from using things like PDSA cycles to test change ideas, supported by deeper understanding of measurement for improvement? If we can align with and leverage off all the improvement work we do, we think that will help our efforts considerably, but we're yet to try that and test it. The third strategic question for us is how do we move community organising into a central plank of the district-wide improvement work? At the moment we have one campaign with a set of sub-campaigns that you've heard about from Alex just now, in just one part of our district's population, which is Pacific youth. This feels like what quality improvement as a whole felt like a decade or more ago, a small start with a whole lot more to offer. We think community organising offers a real opportunity to effect lasting change at scale with some of those population health issues that have been hard to change using traditional project or service delivery models. So our challenge now is to quickly build a track record and to grow confidence that this approach is worth investing in. I'm keen to hear people's thoughts about that. So I'm going to stop there and hand back to Peter, who I think will help lead us in any questions or comments that we have. Thank you.
Thank you very much. And I wonder if I could start with a question to Hahrie and just ask you to reflect on how the Handle the Jandal campaign has developed and how you see the approach could be used in other areas.
Sure. Well, it's been absolutely my privilege to be able to work with the folks in New Zealand on the Handle the Jandal campaign because it's been really exciting to see the way in which they've been trying to innovate on different ways to apply organizing to solving problems in health. And part of what I think is really important about what we're learning from the work in Handle the Jandal is that part of the way that we can begin to tackle problems having to do with mental health or perhaps even other issues has to do with developing the individual and collective capacity of Pacific youth to act on their own health. Right? So the idea is that so often we see health problems and we think, oh, we'll put in another hospital, or we'll, provide more services, or or even in some cases like we'll build a school, or we'll, create new institutions to help address this issue. But we never, or not never, but we rarely think about how do we actually change people's own capacities or their own sense that they have the power to take control of their and desire to act on their own health. And I think what we found is that with organizing, by developing people's leadership on through the work they're doing on Handle the Jandal, they're beginning to sort of develop their own leadership and their own power to act on their health. And that's having some important implications, both on the communities in which they work and on the youth themselves who are working in the campaign. And so to get to your question, Peter, I think that has important possibilities in a range of other different health-related problems, where part of the theory of change, or part of the problem that we're trying to solve, is a problem in which ordinary people whose health we're trying to improve don't at this point have the power to act on their own health. And so if we can use organizing as a way to begin to develop that power, then it can have pretty broad implications.
That's great. Thank you very much for that. Another question, perhaps, is we've seen some fabulous projects which have really helped individual communities. And I'd just like to ask Jonathan about the plans for scaling up this approach in New Zealand.
Thank you, Peter. I'd perhaps answer that question by thinking together about the opportunities to combine community organising with the other improvement methodologies that we're all engaged in. Margaret touched on this. I know in Wales, and I know here, we're constantly discussing how to move to scale, how to accelerate improvement. And we've been blessed to have expertise from IHI and other friends around the world that have helped us build collaborative improvements using the model for improvement. I know Margaret and others on this call are really fascinated about the opportunity to build this capability alongside and intertwined with community organising. Today in Koawatea, we have 2 huge collaborative improvement projects going in different parts of the building. We have this call going on with you around community organising. I suppose my dream is in a few years' time, they'll all be fused. There'll be a fusion between the two. And at the same time as we accelerate and improve our clinical professionals around the improvements they need to see, we could also simultaneously have the energy and the activation and the transfer of some of that power to our community so that they're conducting or driving or accelerating the process for this larger scale improvement. So there's something exciting about the combination of these issues. So as Margaret and you heard Alex talking about some of our new projects, with the expertise of Hahrie and other friends on the line, I'd really like to see us turbocharge improvement and look at large-scale spread and acceleration by tapping into this wonderful energy of our community. And I've been watching the tweets as they've been going around. That energy is all around us. And Margaret and I were commenting as we walked in today just how tired we feel before the day starts because there's so much going on. But actually, I already feel energized just by the conversations that are happening around this as we tap into the energy of other people. So I don't know if that answers your question, but that's what I wanted to say today, Peter.
Thank you very much. And we've a great question here, which is that we have a long-standing community development programme in Wales targeted at the most disadvantaged communities. And I wondered if, Margaret, you might like to reflect on what the difference between these approaches to community development, which are state-led, differ to the community organising we've talked about this evening.
Sure, and I think probably Hahrie and Jonathan can help with the answer as well. So the main difference that this approach, that I've seen with this approach, community organising, is that you're developing leaders within the community to lead that work. So our job is to, as the state, if you like, or the organisation, is to invest in those other leaders and train them and enable them to then go and build the agency around them. It's that snowflake distributed model that I think you saw a slide of in Alex's presentation. Interestingly, when we did some evaluation and focus group questions or surveys of some of the youth that went through the training programs that we ran, and we asked them the question about how much help did Counties Manukau give you in this work, and the answers came back as saying, well, who's Counties Manukau? And no, we didn't know we had any help at all, and what are they doing? Which is a perfect answer, of course, because that means they're actually taking agency and taking control of their work. So we're an enabler, really, of a network of youth to build their own power and their own resources. I think that's the difference. So there's ownership. The ownership's different.
Thank you. That's a great answer. Hahrie, would you like to comment on that one too?
Sure. So a lot of the community development approaches that I've seen do just really great and important work in bringing resources into a community to work on some of the upstream factors that affect health. But I think one thing that in some ways sort of what they do can work in partnership with community organizing in the ways that Margaret just described, in the sense that I think what organizing does that the community development efforts that I've seen don't do as much of is organizing really begins to sort of develop the individual capacity of people, right? And so one of the questions that we always ask in organizing is, what are the spaces in which people become transformed to be able to act with agency, right? To be able to act on the goals that they have in their lives. And some of those goals might be related to health, and some of those might be related to anything. But if we can create these spaces where people become transformed, then part of what we're finding in Handle the General is that it has all these positive impacts on their health. And so I think a lot of what organizing does is give people that space to develop their own agency so that they can better take advantage of the kinds of resources that might come into a community through community development efforts.
Thank you. That's a great and a supplementary question for you, Hahrie. Is you've seen we've all seen community organising in lots of different contexts, from health to politics, and I wondered if you could just comment on what the major similarities are and where the major differences are in those areas.
Sure. Well, so one thing that when I first began to work in organizing, one thing that a very seasoned organizer told me that has always stuck with me is the simple adage that people are people are people. And it turns out that that's true, that even though there are all sorts of ways in which we live in different countries, we have different cultures within one country, from different social classes and different communities and all these kind of things, that people are people are people. And I think part of where I draw the energy from organizing, and part of what I love about organizing, is that there's something very human about it. And what I mean by that is that I think it really gets at this core of trying to understand how can we, help people become the fullest kind of people they want to be, because the whole theory of change and organizing is that by developing that fullness in individuals and in communities, then they can act. Then they have the resources to act on the goals they want to act on. And so, I've worked with campaigns that range from environmental issues to race issues to health and electoral issues. And what I see is that this process of developing the individual and collective agency of people and communities is very universal across all these different issues and all these different communities around the world. But the differences are more in the kind of strategies that campaigns might use to take the resources that they've built and turn them into the goals that they want, right? So strategy is basically the process that turns what you have into what you want. And what that strategy is, how you turn what you have into what you want, is going to be very dependent on the specific context within which you're working. And so the strategies might be different, but that process of building power is not.
Thank you very much. And a question for Jonathan. We're hearing tonight very much about local work with communities, and yet we're on an international call. And I wonder if, Jonathan, you'd like to reflect on what the benefits are for us as a community interested in this, in the international working?
Thanks, Peter. And then, with your permission, I might try and answer Jeremy's question that's come in as well. But internationally, I don't know about you, but sometimes I feel a bit lonely, even with these fantastic people who are sat around me, or Alex, who's sat in Hawaii, and Hahrie, who's sat in Boston. I feel that we've accelerated our thinking by being networked and continually talking this over together. I think we've come up with these innovative ideas of how to fuse things. I need to keep connecting with people like you, Peter, and the other people on the line. So for me personally, in a very selfish way, this is what feeds our innovation and our energy, and this is my community working with you. So I think there's both a personal benefit to these sort of interconnections, but I also think maybe one day there's a change the world collaborative, and we can organize to totally change and transform the world. Here we're working very much on an Asia-Pacific basis, but imagine if these bright spots around the world, we could join them up and actually be part of something so much bigger than we think about every day. So my community at the moment, and my total focus is the 500,000 people here in South Auckland, but actually my community is all these people on the call, and I know it's a bit trite, but our global community. So, I'm really up for that sort of scale of change and involvement, and I think this is the beginning of it. But Peter, if you'll allow me, I might just answer Jeremy, because Jeremy's put in a really interesting question, and rather than typing in a response, just to respond, Jeremy asked about state and organizational authorities are inherently risk averse. How do you manage the tension between a framework of risk and being open to innovative, positive places a community can take you when they're empowered? This really jumped out at me, because I remember one of the first meetings I had with my district health board, all of my elected and appointed members, and they said, Jonathan, this sounds really exciting, this community organizing, but what if, Jonathan, we give the power away and then they do something we don't want? And to me, that was right at the heart of it. And I remember I didn't know how to answer it very well at the time, and I think I had to go and ask Hahrie. And I remember Hahrie telling me, that that's exactly the tension that we do want. It is their community. We are guests in our community's lives. We are guests in our community's health. And actually, that is the exact right challenge for us. And I think you see that played out in Handle the Jandle. I know my board really wanted us to end up with community organising, whatever that is, probably in brackets, community organising that solved diabetes or solved heart disease. But our community came up with youth suicide in our Pacific community, and that is fantastic. But Jeremy, it is exactly the right tension, and I think they need to be asking those questions, and they need to be comfortable with giving up that power and control. I don't know if, Hahrie, you wanted to comment on it, but I remember you had to mentor me a bit on that issue.
Yeah, no, it's a great question, and it's a tension that we wrestle with in a lot of campaigns because, as we've been saying, a lot of what community organizing does is it transfers power over to the community, and part of what we're trying to do is build up their power. And I think the challenge that I found in working with organizations, and this is where, my partners in New Zealand have just been so innovative and great, is that the organization has to really be willing to take a long view, right? And the theory of change is that in the long term, if we build up the power of the community or the power of the constituents with whom we're working, then everyone wins, right? And so whether it's the bottom line of the organization or whether it's, sort of just focusing on health outcomes or whatever outcomes that you're looking at, that if you're working with an empowered and engaged base of people, then everyone wins in the end. Now, there might be some short-term glitches that have to be worked through in the ways that Jonathan described, but in the long term, the philosophy is that it's a better strategy for both the organization and the community. And it takes some real, I think, courage for an organization to be willing to take that kind of long view.
Thank you. They're fantastic answers to the question. I'm particularly taken by the Change the World collaboration. We'll sign up to that, all of us, I'm sure. So I think it's probably time now to draw this to a close. I'd really like to thank everyone for joining us on the seminar today. A special thanks to the team from Koawatea and to Hahrie Han for the information, the experiences and perspectives you shared with us. It's been really interesting. I've learned so much today, and the things that really stick with me are about this notion of a different form of leadership, new concepts of power based on collective action, collective approaches, the relationships between people, and really a new way to solve some of the more intractable problems that we face in society. We've recorded today's session, and it will be uploaded onto the 1,000 Lives Improvement website in the next few days. And you'll be sent a link of the recording, so you'll be able to listen to that or share with others. When you close the Webex screen at the end of this session, a pop-up window with the session's evaluation will appear. And we'd really, really like you to complete this form so that we can learn as well and improve from your feedback. So if you could take a moment, that would be much appreciated. So I think really it's just time to say goodbye from me, Peter Bradley. And I wish you a pleasant evening or day or whatever it is in your particular time zone. And thank you very much.